Union CNA Practice Test. Question 1. Which of the following should be reported to the nurse immediately during a bed bath? The resident is tired. A new red area on the resident's tailbone. The resident wants to wear a blue shirt. The resident is talkative. New skin breakdown or redness over a bony prominence is a sign of a potential pressure ulcer and must be reported immediately. Question 2. When measuring a resident's blood pressure, the first sound heard is the diastolic pressure, pulse pressure, systolic pressure, mean pressure. The systolic pressure is the top number and represents the pressure when the heart contracts. Question 3. What is the primary goal of restorative care? To perform all tasks for the resident. To help the resident regain or maintain the highest level of function. To cure the resident's illness. To move the resident to a hospital. Restorative care focuses on helping residents maintain or regain their independence and physical function. Question 4. When should standard precautions be used? Only for residents with known infections. Only when the resident is coughing. For every resident at all times. Only when the nurse tells you to. Standard precautions are designed for use with all patients to reduce the risk of transmission of pathogens. Question 5. If a CNA sees another staff member hitting a resident, what is the first action to take? Call the police immediately. Stop the abuse and ensure the resident is safe. Report it at the end of the shift. Ignore it if it doesn't happen again. Safety is the priority. The CNA must intervene to stop the abuse immediately. Question 6. What is the first step in performing any procedure on a resident? Gather supplies. Identify the resident. Wash your hands. Explain the procedure. Hand hygiene is always the first step to prevent infection before touching a resident or equipment. Question 7. Which document describes the tasks a CNA is legally allowed to perform? The resident's care plan. The CNA's job application. The state's scope of practice. The facility's menu. The scope of practice defines the legal limits and responsibilities of the CNA role in that state. Question 8. A resident is choking and cannot speak or breathe. What should the CNA do? Perform the Heimlich maneuver, abdominal thrusts. Offer the resident a glass of water. Wait for the nurse to arrive. Hit the resident on the back. Abdominal thrusts are the standard emergency procedure for a conscious person with a complete airway obstruction. Question 9. Which of the following is an example of objective data? The resident says they have a headache. The resident's blood pressure is 120/80. The resident feels nauseous. The resident is worried about their family. Objective data is observable and measurable information, such as vital signs. Question 10. If a resident is in a vest restraint, how often must they be checked? Every 15 minutes. Every hour. Every 2 hours. Once per shift. Residents in restraints must be monitored at least every 15 minutes to ensure safety and circulation. Question 11. A resident is nearing the end of life. What is the CNA's primary role? To encourage the resident to eat a large meal. To provide comfort and emotional support. To discuss medical treatments with the family. To ignore the resident since they are dying. Palliative care focuses on comfort, dignity, and support for both the resident and their family. Question 12. Which pulse site is most commonly used for taking a routine pulse? Carotid, radial, brachial, apical. The radial pulse, at the wrist, is the most common site for measuring heart rate in adults. Question 13. A resident refuses a bath. What should the CNA do? Force the resident to bathe. Skip the bath and try again later. Tell the resident's family. Document that the resident is difficult. Residents have the right to refuse care. The CNA should respect the refusal and try again at a different time. Question 14. What should a CNA do before entering a resident's room? Walk right in. Knock and wait for permission to enter. Call out the resident's name from the hall. Check the resident's chart. Knocking is a matter of respect and privacy for the resident's home. Question 15. What is the proper method for cleaning the perineal area of a female resident? From back to front, from front to back, in a circular motion, with a scrub brush. Cleaning from front to back, cleanest to dirtiest, prevents the spread of bacteria from the anal area to the urethra. Question 16. How often should a resident who is unable to move be repositioned? Every hour, every 2 hours, once per shift, only when they complain of pain. To prevent pressure ulcers, immobile residents should be repositioned at least every 2 hours. Question 17. What is a common sign of a urinary tract infection, UTI, in an elderly resident? Sudden confusion, increased appetite, better sleep, improved mobility. In the elderly, UTI is often present with cognitive changes or delirium rather than just physical symptoms. Question 18. What is the normal range for an adult's oral temperature? 96.6 to 98.6 F, 97.6 to 99.6 F, 98.6 to 100.6 F, 95.0 to 97.0 F. The average oral temperature is 98.6 degrees Fahrenheit, with a normal range typically between 97.6 degrees Fahrenheit and 99.6 degrees Fahrenheit. Question 19. Which of the following is a sign of dehydration? Clear, pale yellow urine, moist skin, dark, concentrated urine, increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration. Question 20. A resident is having a seizure. What is the CNA's priority? Place a spoon in the resident's mouth. Hold the resident down to stop the shaking. Protect the resident from injury and clear the area. Run out of the room to find help. Safety is key. Protect the head and clear objects away. Never put anything in their mouth or restrain them.